Hi.
Hi, I'm Melina. I'm going to be the nurse helping do your head to toe assessment today.
Okay.
Is that all right?
Sure.
Okay. Could you please tell me your initials and date of birth?
JCA 102072.
Thank you.
Mm-hmm.
Okay. So to start, I'm going to first inspect your head.
Okay.
Okay. So I'm just looking for any abnormalities. Everything looks good. Your skin looks intact. I'm just gonna feel real quick.
Sure.
Just looking for any lumps or bumps or anything like that. Everything feels good. All right. Looks good. Okay. Skin looks normal. You are bald. You do have, some facial hair, which is coarse.
Mm-hmm.
But otherwise, looks okay.
Good.
All right. So now I'm gonna go on to your ears. So first, I'm just going to inspect. All right. And everything looks normal. Just going to palpate. I don't feel any lumps or anything. For this side. And again, this side looks good. No lumps. Any pain or anything?
No.
No. Okay. And so now I'm just going to do a quick little whisper test. So I'm just going to stand behind you.
Okay.
And if you could just take your finger and block your right ear. And I'm just going to whisper 2 words and just repeat them when you hear them.
Apple, orange.
Okay. And now if you could just take your left finger and put it over your left ear. Good. And I'm going to whisper 2 more words and just repeat them when you hear them.
Tree, dog.
Yeah. Very good. Okay. So now, if you don't mind just taking off your glasses,
Sure.
I'm just going to do an inspection of, get that for you,
Thanks.
of your eyes, which they look equal bilaterally. The sclera is nice and white. There's no redness or swelling or anything. And so I'm just going to do a quick palpation of your eyelids.
Okay.
Any pain?
No.
Okay. Very good. And now we're just going to do a couple eye tests.
Okay.
So I have my pen light here. First, I'm just going to check your pupil reaction. So if you can just do me a favor and just look straight ahead, and I'm just going to shine the light into the side of your eye. Just don't look at the light. Okay. And pupils are reactive bilaterally. And now I'm just going to do a couple eye tests. So I'm just going to stand in front of you here, and I'm just going to have you follow my pen, okay?
Okay.
Very good. So that was testing your extraocular movements, and now I'm just going to test for accommodation. So what I'm going to do is I'm going to take my pen light and I'm going to bring it towards your face, and you just need to follow the pen.
Okay.
And I'm going to bring it back out and just follow it back out. Okay, very good. And there were no abnormal eye movements throughout that. So thank you.
Mm-hmm.
And if I were to have a Snellen chart, that is for an eye exam, I would have that on the wall. I'd have you stand 20 feet away, and I would have you first read line 6, and if you couldn't, I would have you read up the lines until you were able to read it.
Okay.
Okay. So now I'm going to move on to your nose. Your nose looks symmetrical, and I'm just going to have you block one nostril and breathe in and out. Good. And block your other nostril and breathe in and out. Very good. And I can hear the airflow. Does it feel patent?
Mm-hmm.
Okay. And then I'm also just going to inspect your nares. Okay. Everything looks good. No drainage or anything?
No.
Okay. Very good. So now I'm also just going to feel for your sinuses, okay?
Okay.
So my fingers on your face. Any tenderness or pressure?
No.
Very good. Okay. And I also need to just test your sense of smell.
Okay.
Any issues with your sense of smell?
No.
Okay. So I'm just going to have you close your eyes.
Mm-hmm.
I'm just going to have you smell what I have in front of you.
Mm-hmm.
Are you able to smell that?
Yes.
Okay. What's it smell like?
Mass assault.
Very good. You can open your eyes then. Thank you.
Mm-hmm.
Okay, so moving on to your mouth. If you just open your mouth for me, I'm just going to check your oral mucosa. Okay, that all looks good. Are you able to stick your tongue out? Lift it up. Okay, down, left, and right. Okay, everything looks good. Everything's nice and pink. I don't see any sort of lesions or sores or anything like that. So if I were to test your gag reflex also, I would just take like a Q-tip and I would touch the posterior part of your throat to test your gag reflex. So now let's move on to your lymph nodes. So I'm just going to place my hands on your face and
Okay.
just feel for your lymph nodes here, behind here, and then down your neck. Any pain?
No.
Very good, and I didn't feel anything, any lumps or anything. So one more test for your face. I'm just gonna have you lift your eyebrows. Okay, good. Can you close your eyes really tight? Okay, open. Puff your cheeks out. Good, and purse your lips. Very good. Okay, so now moving down to your neck. I see your neck looks normal. There are no skin issues there. Could you just turn your head to the right for me? I don't see any jugular vein distension here. And to the other side, I also don't see any here, which is great. I am going to check for your carotid pulse. And the other side. Good. And I am just going to take a quick listen.
Mm-hmm.
And there's no evidence of a bruise there, which is great. And I also just need to check your TMJ real quick.
Okay.
So I'm just going to put my hands here. You can open your mouth and close, open and close. Okay, you've got a little bit of a cracking over on this side. Do you clench your teeth at all or anything? No. Okay. So could you actually just open your mouth a little bit and clench your, move your jaw from side to side? Very good.
Mm-hmm.
Okay. Now, I'm going to have you test your range of motion of your neck. So could you just please tilt your chin to your chest? Very good. And back. Okay. To the left. Yep. To the right. Okay. And can you do your right shoulder to your right ear to your right shoulder? And your left ear to your left shoulder. Very good. And we're going to do the same type of movements. I'm just going to put my hand here just to test their strength. So lean
Okay.
forward. Good. Back. Good. To the right. Good. And to the left. Very good. And can you just shrug your shoulders? Very good. Okay, so now we're going to move on to your arms. Let's see. You have tattoos, obviously, but otherwise the skin looks intact. Not dry or anything like that. You do have some hair that's coarse, normal growth appearing. So first we're just gonna take your arm and we're just gonna check the range of motion. If that all feels good, and I'm gonna have you turn your hand in and out. Very good. And I'm going to check your brachial pulse. Okay. And also on this side, we're gonna turn your arm in and out. Very good, and up towards you for me, flex. Yep, very good. And also, okay, very good. And let me do your radial pulses while I'm here. Okay, and those feel great as well. Let's actually do a quick strength test. So if
Okay.
you could just squeeze my fingers. Very good, perfect. All right, now I'm going to listen to your heart sounds.
Okay.
Okay? First, going to listen with the side.
Okay.
I'm just gonna listen again with the other side of my stethoscope.
Okay.
Okay, that all sounded normal. I didn't notice any abnormal S1, S2 rhythm. I'm just gonna add that too. Okay, so now I will move on to do an inspection of your chest, which is rising and falling symmetrically, and even the back of your room. All right. Can you just repeat 99 for me?
99.
Okay, very good. And I felt the vibration equally. So now I'm going to listen to your lung sound. So I'm going to take a few deep breaths when I
Okay.
ask. Okay, deep breath. One. Another deep breath. Again. And one more. Okay, one sounds clear. And I'm just gonna listen again in that same order, and I'm just gonna ask you to repeat 99 for me, okay?
Okay.
All right, 99,
99.
again,
99.
again,
99.
again,
99.
one more.
99.
Perfect. All right, now I'm just gonna listen to you on the back here. I'll have you do a few deep breaths again, and then we'll do the 99 again.
Okay.
All right. And one. Again. Again. One more. Okay, now I'm gonna go through that same order, and I'll just have you say 99.
Okay.
99,
99.
again,
99.
again,
99.
again,
99.
again,
99.
again,
99.
again,
99. 99.
and one more.
99.
Okay, very good. All right, so now I am going to do an inspection of your abdomen. So if you don't mind just laying on your back.
Okay.
All right, so normally I would inspect your bare abdomen, but we're gonna leave your shirt. Okay. But I would just look for any abnormalities of the shape of your stomach, look for any lumps that would indicate like a hernia, which I don't see anything, and this, skin would be hopefully warm, dry, and intact. So first, I am going to take a listen
Okay.
of your vowel sounds real quick. So you can breathe normally. Okay, and vowel sounds are normal. While I'm here, I am just going to listen to your aorta and your renal arteries.
Okay.
everything sounded good. I didn't hear any brewery or anything like that. And I could also inspect your femoral arteries, which are in your groin. Next, I am going to just do a little percussion on your belly. So just let me know if you have any pain, okay?
Okay.
Okay, and how was that? Okay?
Yep.
No pain or anything?
No
Very
pain.
good. Very good. All right, and now I will just do a light palpation of your belly, okay? So just let me know if you have any pain. Okay, and your belly is nice and soft. Okay, while I have you laying down, do you mind if I just remove your shoes so I can just check the capillary refill on your feet?
Oh, sure.
Do you just let them off?
Yeah. Make it easier.
All right. So I am just gonna lift this up just a little bit, just so I can do a little skin inspection.
Sure.
Which more tattoos on this side,
Yes.
and you also have, normal hair growth. All right, feet look good. Just gonna squeeze a little bit. Okay, capillary refill is normal. Same on this side. Everything looks good. Capillary refill is normal. Alright, and I do not see any pitting edema or any edema in your lower legs either. Alright, while I'm here, I'm just going to do testing of your ankle range of motion. So if you
Okay.
could put your toes to the ceiling, alright, and down, okay, out to the left, or sides, I guess, and to the right, okay, and can you curl your toes for me? Okay, very good. And can you push against my hands? Good, and this way, very good. And I'm going to feel, I should get your socks off, sorry, your post-tibial artery, or post-tibial pulse. And dorsalis pedis. Okay, and all of those feel great. Okay. Very good. We are just going to do a range of motion of your hips while you're lying down.
Okay.
So could you take your right leg and swing it up towards the right, away from your body, okay, and back. Okay, and then you're going to take your right leg and put it over your left leg. Good, and back. We're going to do the same with your left leg. You can bring it out to the side, very good, and back. And then your left leg over your right again. Very good. And back. Okay. I need to check your popliteal pulses as well.
Mm-hmm.
Okay, that feels good. Okay, so now I can help you sit up. Okay, and you can put these back on because I'm gonna have to do a couple standing tests as well.
Sure.
Wash my hands after touching.
Sure, sure.
All right, and I just remembered I need to check just the range of motion in your wrists as well.
Okay.
So if you can just put your wrists out for me like that, okay, and go put them up, down, side to side. Very good. Push against my hands. And this way. Very good. And I am going to check your capillary refill of your fingers, which is good. Less than 2 seconds. Perfect. Okay. So now I'm going to do a kind of like a balance test. Okay.
Okay.
So if you could just stand up without leaning, and close your eyes for about a few seconds. I'll tell you when. So here I'm just looking for any abnormal movements or, you needing to catch yourself or your balance. Okay, that looks good. And so now you can open your eyes. And are you able to take your finger and touch your nose? Very good. Other side. Very good. And can you do like a rapid alternating movement, like just kind of like this, or yeah. Good. Now the side. Very good. And can you take your right heel and you're gonna put it to your left knee and run it down your leg. Good. And you're gonna do the same with the left heel and run it down your right shin. Okay, very good. And can you just walk a short distance for me? Okay, and turn back, and I'm gonna have you go heel to toe. Very good. Okay, and I'm gonna have you go back one more time on your tippy toes. And I'll have you come back on your heels. Perfect. Okay. If you want, you may have a seat.
Okay.
I'm just gonna do a couple more things here. All right, so first, if you can just put your right hand out, and I'm gonna have you close your eyes, and I'm just gonna draw something in your hand, and you just gotta tell me what it is.
A.
Very good,
A Z.
very good. Now I'm just gonna put an object in your right hand, if you could just tell me what it is. Feel it?
A coin.
Yep. And one more.
A key.
Yep. And I'm gonna do it on your left hand.
Pen cap.
Yep. And one more.
Key.
Very good. You may open your eyes. All right, and next is a sensory test, which I'm actually gonna have you close your eyes again.
Okay.
But it's either gonna be a dull or soft sensation, so
Okay.
just let me know what you feel first, okay?
Soft. 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 Soft.
Okay?
Sharp. 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 Sharp.
Very good. Okay. So now we'll do a little bit of a memory test.
Okay.
Are you able to tell me where you are right now?
I'm at UMass Memorial Medical Center Hospital,
Okay.
operating room.
Okay, and you know the date?
Today's date is August 5th.
Okay, very good. And are you able to count back from 100 by sevens?
Let's see, 100, 93, 86, 79, 72, 65, 58,
Yep.
51, 44, 37, 30, 23, 16, 9, 2.
Okay, very good. And I'm going to give you 4 words that I'm going to have you repeat after me. We'll do tree, dog, cat, and ball.
Tree, dog, cat, ball.
Okay, now can you count backwards by ones from 20?
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Very good. And now what were the four words that I asked you to remember?
Tree, cat, dog, ball.
Very good. And what did you do to celebrate your last birthday?
Drink.
Drink. Very good. Okay, and one more thing here. I just need you to follow these instructions.
Okay, can I have my glasses?
Oh, sorry,
That's
sorry.
okay.
Yes, of course.
Thank you.
Okay, very good. Okay, and a few last things.
Mhm.
Your skin turgor is good. We did a little tenting test. You don't have any tenting. And I actually forgot to percuss your chest.
Okay.
So we are going to do that real quick.
Sure.
So You can just breathe normally. Okay, very good. Any pain or anything?
No.
Okay, well, thank you so much for your assistance today.
Yeah, thank you.